The thyroid is a small gland located in the neck that produces hormones that regulate metabolism and other bodily functions. When the thyroid gland produces too much or too little of these hormones, it can cause a range of health problems. Some of the most common thyroid problems include hypothyroidism. This occurs when the thyroid gland does not produce enough hormones, leading to fatigue, weight gain, and other symptoms. Hyperthyroidism. This occurs when the thyroid gland produces too much hormones, leading to weight loss, rapid heart rate, and other symptoms. Goiter. This is an enlarged thyroid gland that can cause swelling in the neck and difficulty swallowing or breathing. Thyroid nodules. These are lumps or growths that can develop on the thyroid gland and may require further testing or treatment. Thyroid disorders are a significant health issue in India, with a high prevalence rate. According to a study conducted by the Indian Thyroid Society, approximately 42 million people in India suffer from thyroid disorders, with a prevalence rate of around 10.95% among the general population. Thyroid problems are more common in women than men, with a female-to-male ratio of 5:1. The condition can affect people of all ages, from infants to the elderly. However, it is more prevalent among women above the age of 35 years. The study also found that iodine deficiency was a significant cause of thyroid disorders in India, particularly in areas where the soil is deficient in iodine. Lack of awareness, inadequate screening programs, and poor access to healthcare services were also identified as major factors contributing to the high prevalence of thyroid disorders in India. Thyroid problems can occur at any age but are more common in women and people over the age of 60. The causes of thyroid problems can vary, but some risk factors include genetics, autoimmune disorders, iodine deficiency, radiation exposure, and certain medications. Treatment for thyroid problems can depend on the type and severity of the condition. Hypothyroidism is typically treated with hormone replacement therapy, while hyperthyroidism may require medications, radioactive iodine therapy, or surgery. Goiters or nodules may also require surgery or other treatments, depending on the size and location of the growths. While some risk factors for thyroid disorders such as genetics and age cannot be controlled, there are certain lifestyle changes that can help prevent or manage thyroid problems. Here are some tips for preventing thyroid disorders. Maintain a healthy diet. Eating a balanced diet that is rich in iodine, selenium, and other essential nutrients can help support thyroid function. Good sources of iodine include seaweed, iodized salt, and seafood, while selenium can be found in Brazil nuts, eggs, and fish. Exercise regularly. Regular physical activity can help regulate hormones and promote overall health, including thyroid function. Avoid exposure to radiation. Radiation exposure can increase the risk of thyroid cancer, so it is essential to minimize exposure to sources of radiation, such as X-rays and nuclear fallout. Manage stress. Chronic stress can affect the functioning of the thyroid gland and other hormones, so managing stress through relaxation techniques such as yoga, meditation, or deep breathing can be helpful. Regular screening. Early detection and treatment of thyroid disorders can help prevent complications, so it is essential to have regular checkups and screenings if you are at risk for thyroid problems. In terms of foods to suggest for thyroid health, including the following in the diet may be beneficial. Iodine-rich foods like seaweed, iodized salt, and seafood. Foods high in selenium like Brazil nuts, eggs, and fish. Fruits and vegetables, particularly those high in antioxidants like berries and leafy greens. Whole grains and legumes, which can provide essential nutrients like B vitamins and zinc. It is important to note that while diet and lifestyle changes can be helpful in managing thyroid disorders, they should not be used as a substitute for medical treatment. If you suspect you have a thyroid problem, it is important to seek medical attention and follow the treatment plan prescribed by your healthcare provider.